the mesentery, so these are portions of the mesenteric artery and vein. Now, you do need to be able to identify the different regions of the large intestine, which includes the cecum, the vermiform appendix, the ileocecal valve, the ileum, the ascending colon, the transverse colon, the descending colon, the sigmoid colon, which then leads into the rectum, which is not visible on this model. Now, there are some additional structures you'll need to be able to identify on the model, which includes this white line right here, this white line that comes across. That, of course, is called the tenae coli, which is actually a tendon of the colon, which is why it's called tenae coli. You will also note that the large intestine comes in sections. See little bumps there? Little bumps. Each bump right there on the intestine is a hostrum. And so if I took a pin and I put it on either side of this little bump and I said, what is the structure in between these pins? You would say, oh, that's the hostrum. Okay? Now, at the top here, where you see that there's a bend, notice that there's a bend here. When you have a bend between two bones that shorten the distance between two bones, that is called flexion. Well, this is a shortening of the distance between two intestinal components, so this is called a flexure. Okay? So this is a flexure on the right side, and this is the flexure on the left side. The flexure on the right side happens to be near the liver. The flexure on the left side happens to be near the spleen. So the one on the right side is called the hepatic flexure, and the one on the left side is called the splenic flexure, which is why you see here right colic flexure, also known as the hepatic flexure, left colic flexure, also known as the splenic flexure, and you will see that on here. Okay? Now, on the picture, you'll see that there's some additional structures that are not on the model, which includes the anal canal and the rectum, the external anal sphincter, as well as the epiploic appendages, which are basically very similar to Peyer's patches and the appendix, except they're lined along the different components or areas of the intestine. So that's what that is there. Again, the ileocecal valve, which is here, is, again, this little small area right here on the model. Okay? And then, of course, you see here's the ileum right there, and there's the ileum right there. Okay? Again, I've already kind of gone through all of that on the model as well as on the picture. Again, I can only ask 4 questions per model, which means I can't ask enough on the model, which means more than likely I will also have to use the picture. So you do need to know both the model and the picture. And of course the cat, because you will need to be able to identify the different areas of the large intestine on the cat, as well as the different areas of the small intestine on the cat, which includes the ileum, the jejunum, and the duodenum. Which again, the duodenum is the area of the small intestine which connects to that of the stomach, and then the ileum is the area of the small intestine which connects to that of the large intestine. And then the other stuff that's in between the ileum and the duodenum is the jejunum. Not that difficult when identifying that on the cat. I already talked about